These are nurse-initiated protocols, and these are the ones principally that we're going to be used at bedside. And I'm going to take these through. There's a whole group of these we're going to go through today. And we're going to kind of go through in alphabetical order. The first one, and you will have an attachment, you should be able to print this out and be able to refer to the first one, is abdominal pain. And this is actually the most complicated of all the nurse-initiated protocols. There's not a whole lot that's new here, but let's quickly go through it. So if you refer to your attachment on the abdominal pain, if the patient's vomiting and they didn't receive Zofran in triage, you can either give tenofovir IV or Zofran 4 milligrams IV and give a fluid bolus of 500 cc's. Don't want to do that if there's a history of congestive heart failure or renal failure. For severe pain, of course, pain protocol, but let the emergency physician know. I don't want pain protocol initiated on anybody without letting the physician know that you're going to do that, because pretty soon the physician wants to get over and try to get the patient evaluated before the full effect of the morphine is there. If there's moderate pain, you can use Toradol IV as long as the patient's not allergic to NSAIDs or aspirin. And of course, if it's an abdominal pain patient, particularly upper abdominal pain, they're more than 35 years old and you're not sure, get an EKG. This is important because a lot of cardiac pain or ischemic pain will manifest as upper abdominal pain, so go ahead and do that. If there's lower abdominal pain, go ahead and get a urine pregnancy test, an RH. Now we've now broken this down into what type of pain the patient has. And so you obviously, in order to follow protocol, have got to examine the patient, because we have this broken down to right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant pain. So you really have to know what you're dealing with. And we start with right upper quadrant pain, and this is the most common presentation we have in an emergency department, where the patient comes in with epigastric right upper quadrant pain and they come in with vomiting. And principally we're usually looking at something that has to do with the stomach or gallbladder or pancreas here. So the workup should be a CBC urine, a pregnancy test, a CMP, and a lipase. So the reason we get a CMP rather than BMP is a CMP has all the liver function tests on it. And the lipase, we're checking for pancreatitis. So that's the workup. You're not asked to be doing ultrasounds or anything like this. This just gets the workup started. The emergency physician will decide whether they need any imaging studies.
Dr. Holland, I have a question.
Sure.
So you said that talk to the doctor first, but when should we actually initiate them?
So once you can initiate this protocol without the provider there, but if you're going to start pain protocol, let the physician know you have somebody in bad pain, I'm going to start pain protocol. Let them know you're doing it. So you're not asking for permission. Tell them you're going to do it because the patient is suffering. I don't want it to be dependent on the physician saying yes or no, because they may not be able to get over the patient for some unknown period of time, and the patient's going to be suffering. So let them know that I have a patient in severe pain, I want to start pain protocol.
Okay, so that was my question. So if it's not busy and you're able to see the patient right away, we don't need to initiate them if you're going to see them.
Again, it's the whole hypothesis here is you only want to initiate if the provider can't get there within 15 or 20 minutes of the patient hitting the bed.
Okay. Thank you.
That gets the workup started, right? So the next breakdown is left upper quadrant pain. You're really talking about almost the same kind of workup. So it's CBC urine, pregnancy test, CMP, and lipase. Now for right lower quadrant pain, we're kind of thinking more about appendicitis or colitis or diverticulitis. So here it's the same lab work, except instead of a CMP, we're doing a BMP because we don't need liver function tests. And then imaging will be done by the emergency physician. Same thing with left lower quadrant pain. If you have generalized abdominal pain, and some people can't localize it, it's the whole workup. CBC, CMP, lipase, DIPUA, and pregnancy test in a female. So the only thing we've really done here is we've broken it out depending on what type of abdominal pain it is. The workup changes a little bit. If you have any questions, just ask the doctor that's on. Okay. The second nurse-initiated protocol is allergic reaction, and you guys are all familiar with that. I'm sure you've all started this, but let's quickly go through it and refer to your protocol on allergic reaction. So obviously these people can go down quickly, so you need to make sure that we're aggressive, and that means we're prepared to take care of somebody who gets sick in a hurry. So the first thing, obviously IVO2 monitor. And then if the patient's hypotensive, we need to get fluids in them. You need to get the emergency doctor over right away, and we want to start epi 1 to 1,000, 0.3 cc's IM. We use IM rather than sub-Q because it's much more fast and much more quickly absorbed. So, and that can be repeated every 5 to 10 minutes. But you have somebody that's sick, I want the doc over right away. you need to get them involved as quickly as possible. Question?